Good morning, ladies and gentlemen. My name is Saul Johnson. I'm the Managing Director of Health and Development Africa. We're part of the Mott MacDonald Group. HDA works across the Southern African region, working with clients and partners to provide health consulting services around a range of health issues, including HIV and AIDS.
We'd like to share something with you on the Amaqhawe Project, a project we envisaged, planned, and continue to execute as a solution to one of the numerous facets of HIV epidemic in South Africa.
South Africa has one of the highest HIV infection rates in the world, with about 5.5 million people infected with HIV and living with the disease. Although the introduction of antiretroviral therapy has helped to stem the tide of AIDS-related deaths, HIV remains one of the major challenges for our country.
Sibande district is situated on the border of Swaziland and Mozambique, and it sits astride the intersection of several South African major road transport routes, coal mines and power generating facilities. A large migrant and transient population creates a mobile base for the epidemic into and out of the district. Our initial studies revealed that many drivers overnight in Sibande district and visit numerous taverns which have sprung up to cater for their needs.
We discovered that one of the key drivers in Sibande of the HIV epidemic is sex work initiated in taverns. This is quite unusual in South Africa, as most new infections tend to occur in the general population. Previous research in South Africa suggests that between 50% and 70% of all sex workers are HIV positive. And our research suggested that many sexual acts were actually unprotected. For example, truck drivers could be infected with HIV through having unprotected sex with sex workers. They in turn infect their wives and their partners at home. Preventing new infections among sex workers therefore has the potential to decrease HIV infection rates among the general population. Our first innovation is that we try to understand sex workers primarily as women, as well as trying to really understand the environment in which they operate. Our second innovation is the creation of a unique brand which resonates with sex workers.
Our third innovation is the development of the first magazine for sex workers. We met with sex workers to understand their media consumption patterns. It is clear that magazines were the most commonly accessed small media.
With these two important findings in mind, we developed the Amaqhawe magazine, styled off a successful women's magazine like Cosmopolitan. Our magazine is a quarterly publication developed in consultation with the sex workers and distributed free of charge to them. Before defining each issue, we asked sex workers what topics they'd like to see covered. Then our staff members compile the articles with a lot of care, and we message the editorial to be back in line with the key messages we wish to convey, but without ever becoming preachy or the editorial losing its street cred. Our client, the CDC and the United States government, has described us as unique, creative and innovative. However, we know that the true value of this project is not only to our client, but to the sex workers and their clients, whose health and quality of life we are striving to improve. Thank you.